Welcome to the Health Daily Show, your go-to where leaders, founders, and investors share insights on growth, innovation, and business building. I'm Chitra Nabat, your host. Joining us today is Dr. Rekha Kumar, Found Chief Medical Officer. Rekha, welcome. Thank you for joining us.
Thank you so much for having me.
Rekha, what is Found? How does it work?
Found is a digital health company that treats obesity. So we have two sides. We have the behavioral intervention side that has health coaches, exercise physiologists, nutritionists. We also have a telehealth side with physicians, clinicians who can prescribe anti-obesity pharmacotherapy when appropriate. It's that combined approach, behavior change plus medicine, delivered through technology that treats our patients.
What you just described there can be difficult for folks to discern, right? Research says 40% of adults and 20% of children have obesity. The US obesity treatment market is about 15 billion. The US weight loss market is about 160 billion. We're inundated with options, overwhelmed, right? Whether it's regimens of diet and exercise, your doctor prescribing things, WW, Nutrisystem, weight loss diet apps. There's a lot on the news right now about people using GLP-1s such as Ozempic to lose weight, and a lot of celebrities popularizing it because that's what they're using to get thin. Make sense of all of this for us.
Yeah, I think this sounds confusing because it actually is. I'll start by saying that obesity is a heterogeneous disease, meaning it's different in each person. It may look the same on the outside, meaning somebody carries an excess of body fat, but the root cause of each person's weight gain can be very different, which is why people go to different solutions. It's part of the reason people go to different solutions, that not the same thing will work for everyone. The same lifestyle program won't work for everyone. The same medication won't work for everyone. And so you see all of this noise in this space because people are really trying to find something that works. The problem is not everything's going to work for every individual. And we've only recently learned the science of obesity, and now you're hearing all about GLP-1s and medications. These medicines have been around a long time, but they're changing the entire paradigm of how weight loss is thought of, meaning it's not just willpower, so it's not just diet and exercise, and there's a biological component.
Where's your sweet spot? How do you guys differentiate and stand out?
I would say where Found stands out is in its clinical rigor. We are very protocol driven. We are also interested in personalizing care to the individual and scaling both of those. And those are hard to do if the disease is heterogeneous.
And in that population, when you talked about, obesity is heterogeneous, is there a sweet spot of patient, consumer that you serve?
Yeah, that's a good question. I would say that we serve the patients who feel like they have tried and failed all commercial lifestyle interventions, but don't necessarily meet criteria to have surgery. So that middle ground between need something between just lifestyle change before surgical intervention.
And just as you talked about that obesity is heterogeneous, so is the individual. Every individual is unique and different. So take us into the methodology, because do you do testing in terms of testing the person's food restrictions or food allergies, urine, blood, different body types, different stage of life that you're in, whether it's menopause or pregnancy? Take us into the methodology.
Yeah, so I agree that all those things factor into figuring out the root cause. So biological sex, age, hormone status, family history, medication somebody is on, certain blood work biomarkers, all of these factor in to how Found tries to pinpoint the root cause and then choose a medical and behavioral regimen based on that.
Give us some examples, bring it to life for us, some of the outcomes that you've delivered.
Sure. So just in terms of outcomes, like straight up efficacy stats, 90% of our patients lose 10% of their body weight at 1 year, and 15% of our patients lose about 20% of their body weight at 1 year. So in terms of efficacy, and this is speaking with generic medicines, not GLP-1s. So we're seeing clinically significant weight loss, prescribing a range of medicines, often generic, not just GLP-1.
So when you talk about year one weight loss, year two, how do you get into that patient consumer retention? Because this is the kind of thing where someone could try it. It could be transactional. They could try it for a period of time. Maybe they don't see sufficient health improvement outcome or whatever it is they're looking for, weight loss improvement. So how do you think about that consumer acquisition, engagement, retention?
Yeah, so I think
The stickiness.
that is one of the hardest things in direct-to-consumer healthcare. I would say that patients are more likely to stay if the first thing we do works. And that is why we need to personalize and get to the root cause. Because if we, just do something very algorithmic and it works for 10% of the people will churn. So by getting to the root cause, choosing a plan that works, hopefully they see efficacy that motivates them to stay. And we're gonna have to modify the behavioral program as time goes on and make it interesting and exciting. We have a community that the Found members engage with over the app, and that keeps people excited, it keeps people going. But I agree with you, that's one of the biggest challenges.
And a little bit more on how you change behavior, because it's difficult to get people to just eat the right vegetables, eat their broccoli, much less commit and do something like this. So how do you think about changing people's behavior, but also too in the backdrop of this recessionary macroeconomic environment, right? There's job loss, there's inflation. People may view this as still discretionary. So how are you getting people to change behavior, commit, and leading to Found getting to market adoption at scale?
Yeah, so in regards to changing behavior, I think we try to deliver a personalized behavioral program as well as a personalized medical program. So if someone comes to us and nutrition's in place, exercise is in place, but we notice that sleep is the issue, we will go for the things first that we think we would get the most benefit from adjusting. And we encourage, logging routines, engaging with the community, things where there's feedback in a way that makes people want to keep doing it. And then in regards to this being discretionary, I would say that metabolic disease, diabetes, and obesity are costing the country, much more than anything else in healthcare. And we really need to focus on prevention, root cause of diabetes and cardiovascular disease, which is treating weight. So although it appears discretionary and cosmetic, I would say that in the long term, if we can treat this well, we will save.
Talking about the cost, the savings bit, let's get into the B2B to C model, right? Because Found now has a payer channel, and this year you launched an employer channel. What's unique about the value proposition to each of these channels?
So I'd say the direct-to-consumer model, I think, is great because it's really for people that can't access obesity medicine care through their traditional channels, through their employer health insurance. Perhaps they live in a place where this care isn't accessible. And then in regards to the B2B working with employers, I think that despite having, an employer-based program, that because of the personalized model, that within Found employer track, we could still tailor care to each employee.
Can you give us an example? Bring that to life.
Great. So an example would be, say somebody wants to join the program and they, we fill out all the information, fill out their root cause, and we learn that the root cause is cravings. That is the driving factor of their weight gain. We will match that root cause with a particular medicine. Not every other employee for that business that joins Found gets that same medicine. Based on their root cause, say it is emotional eating, they'll get a medicine that matches that. And they'll get a behavioral plan that matches that too. So it's not like a one size fits all, even for a particular employer.
Rekha, let's get into leadership. In career, business life, there are rules, codes, norms to how things are done. Where have you been a code breaker, and how did you do it?
I think the place I've been a biggest code breaker is probably from making the transition from academia to a startup, which those are two different worlds. They usually don't function on the same realm in any way. But I would say that being in academic obesity medicine, which was a cutting edge field, just lent itself to being a pinch more innovative than the traditional academic. And it was, at first, I would say that whole drinking from the fire hose analogy. Startups are fast paced. They, work around the clock. And we do that in medicine, but it's a different pace of life. And so I'd say that was a hard transition, but I feel like the two complement each other really well.
Rekha, thank you so much for joining us.
Thank you for having me.